We are joined by Dr. Eric Miller of Lima Memorial Health System and their Foot and Ankle Center. First of all, thanks for joining us today, Doctor. Today we're talking about sports injuries to the foot and ankle area. So what are some of the most common types of injuries that you see?
Most commonly see patients that have ankle fractures, ankle sprains. Ankle sprain is very commonly seen. It's very often happening to people that are athletes, whether it's an athlete at school or athlete outside of school, older people doing activities, different sports, things of that nature. But those are what we see most common with those.
I know I was an athlete in high school, and it seemed like my right ankle rolled constantly, and we're not just talking a little bit of a sprained ankle. It would really flip all the way over to the side. Is that something that's pretty common?
We do see that. Some of the people that have an advanced ankle sprain, the ankle ligaments are stretched out in position, and it doesn't hold the ankle as tight in position as it should. Usually we try to treat these conservatively as much as possible, or if it's an athlete during their sports season, we do what we can to try to get them returning the sport as safely as possible for that season and then rehabilitate it and see how they can do with it. There are some that if it does not work with physical therapy, conservative treatment, those are the ones we do have to repair those ankle ligaments and stabilize the ankle.
I know that overuse and repetitive motions of injured areas can also play a big role. What can happen if these injuries are just kind of let go and not treated for a very long time?
A lot of times what we see are people with overuse injuries such as tendonitis conditions of their Achilles tendon or other tendons of the foot and ankle. Over time, if you have chronic repetitive trauma or aggravating factors, it doesn't allow that to heal. Sometimes the tendons can develop small tears within the length of the tendon, or they can become thickened and cause issues with it.
And what are some of the different treatment options? I know people sometimes get scared because they think surgery is the immediate option, but what are some of the things you can do?
Sure, surgery is the last option with these things. This is something that usually can resolve with conservative treatment. The first thing is what we call relative rest. If people are doing a lot of running or walking on a treadmill on an incline, we definitely take away that aggravating factor or aggravating condition or problem. And then we have them riding a bike, doing elliptical, swimming, something where they're still exercising. They're giving that tendon or ligament a chance to heal itself. Sometimes they have to be immobilized in a boot briefly if need be, or other treatments such as physical therapy, medications, and for certain conditions, also injections depending on the location for it.
Okay, and if someone's watching today and they would like to get more information, how can they contact you?
Sure, there should be a number at the bottom of the screen, 419-998-8278.
All right, Dr. Eric Miller, thank you so very much for your wealth of information this morning, and we'll be back with more right after this.